Nice to see you again in this video, or rather small series of videos. Now it is time to come to one of the most important lessons in this program. It's about the so-called trigger point massage. To be precise, the external trigger point massage. We want to explain three things in this video. What is a trigger point? How is it treated? And why is it so important? Alright, so first of all, what is a trigger point? By definition, a trigger point is a painful area in the muscles or in the tendons. Sometimes one also speaks of fascial trigger points. Fascia is a particular type of our supporting and connective tissue. One speaks of a trigger point because when this point is touched, something is activated or triggered. Put simply, a fascial trigger point is a point on your body where a noticeable pain is triggered when you press on the tissue under the skin. Sometimes you experience a real muscle twitch for the first time you press, and the pain can manifest itself in a more distant area. The projected or radiating pain is then always roughly the same for the respective trigger point. For example, you may press a point on your lower abdomen and it feels like a pain is running down your entire leg from that point. Trigger points can be anywhere. For instance, you might find a trigger point on the shoulder that will pull up to your head. Maybe you already know some painful points on your body. If not, we'll explore them now. That sounds simple at first, but it can sometimes turn out to be looking for a needle in a haystack, especially if you have no idea where to start. But once you've found a trigger point, you'll recognize it very quickly. As I mentioned before, all we have to do is press a point. It's best just to use one finger. For example, we press our middle finger on a part of the soft tissue or directly on a muscle and see whether something is triggered. Or to put it bluntly, whether something hurts. If you touch such a trigger point, at first it usually feels like a sting. It's good if we can locate these points, but of course it's not a good thing that we have them. Which brings us to the third question. Why is it so important to find and resolve trigger points? Imagine that a thin skin has been drawn over your tissue and muscles in which uncountable nerve tracts run. These neural pathways flow throughout your body from your head to the tips of your toes. And these nerve tracts on the thin skin over the tissue and muscles want and have to flow, so to speak. But sometimes, especially through incorrect movement or posture, myofascial sticking can occur. This means that the thin skin with the nerve tracts no longer firmly, evenly and flexibly encloses the tissue or muscles. Rather, the skin has stuck to the tissue or muscle due to a lot of pressure and little movement. The skin no longer moves and has literally stuck to the tissue or muscle. This leads to the nerve tracts at this glue point being disturbed. They can no longer flow evenly. Sounds logical? Then you can probably already guess what will happen next. Exactly. A disturbed nerve tissue speaks out and causes pain. The really stupid thing is that the pain does not necessarily arise locally at the point where the sticking occurred. People who have migraines, that means severe headaches, can, for example, have stubborn muscle adhesions in the neck, triggered by a one-sided posture of the neck or poor lying down in a bad position. If you then loosen this adhesion in the neck, there is a good chance that the headache will go away. And that's exactly how it is in your pelvis. Pain in the groin, rectum, genitals or anywhere else in the pelvic region can also be caused by adhesions outside this region. For example, there are many trigger points in the abdominal area. These adhesions in the abdomen can arise, for example, from sitting bent over permanently in a hunched position. As a result, the muscles in the abdomen are pushed together permanently, shortened, and then stick together. It is important to understand first, before we do anything else, that at the beginning of the treatment we have to find critical trigger points that are causing your symptoms. Finding them is much more difficult than solving the problem, because once a point has been found, it only takes a little tact and patience to get it flowing again. A trigger point is released by simply exerting pressure on the point. That means you press lightly on the painful point and then hold this pressure for about 30 to 90 seconds. Then you let go and that's it. Pressing it once a day You can sometimes loosen a bond after just a few days, of course depending on how stubborn it is. It is very important to note here, the motto "a lot helps a lot" does not apply. Under no circumstances should you have excruciating pain. It's better to take it slow, otherwise you can make it worse. On a pain scale of 1 to 10, where 1 is completely pain-free and 10 is extreme pain, we want to have about a 7. Also important, breathe with the abdominal breathing you learned in the previous video while pressing, and relax. You will probably notice that the pain subsides as you press. If it was a 7 on the pain scale at the beginning, you can be a 5 after 60 seconds. The adhesion loosens relatively quickly. The pain may also go away completely but reappear the next day. Stay tuned. Over time, the trigger points disappear faster and stay inactive longer. I recommend that you consult a special therapist who is trained in trigger point therapy and manual therapy, especially at the beginning. He or she can give you a better understanding of what a trigger point feels like and how exactly to press it. When you have got a feeling for it, you can treat the trigger points yourself in the long term and find them again and again in the future. In summary, trigger points are painful areas in your tissue or muscles that, when pressed, trigger pain at the pressed area or another area. Trigger points disrupt the nervous system and can cause permanent pain or other symptoms. Trigger points do not resolve themselves. They have to be eliminated manually by precisely locating the point and solving it with the technique described in this video. Only when there are no more active trigger points will this program with other techniques promise chances of success. So, I'd say enough theory, let's see if you have trigger points.